Hello, everyone. My name is Wayne Tucker, the host for the Infection Control Exchange podcast. And in this episode, we're going to talk about the critical role of stakeholders and IPAC programs, so infection prevention and control program. So often IPACs is just viewed as responsibility for staff that's on the IPAC team, like the lead, the manager, director. But in reality, IPAC success is dependent on the stakeholder engagement across the system. So you can have the best IPAC policies in the world, but without stakeholder engagement, if they're going to fail at the point of care. So we're going to talk about that today. In terms of defining stakeholders, it's any individual or group who will influence, implement, or impact, or impacted by the IPAC practices. So we're going to talk about internal stakeholders. We're going to talk about external stakeholders, some of the common breakdowns that do occur, and leadership strategies to strengthen engagement. So to start off, we'll talk about some of the internal stakeholders. So that would be your frontline staff, your nurse practitioners, your nurses, your PSWs, your allied health professionals. So, they're probably one of the most critical stakeholder groups because they have such close contact with residents and patients. And they really are, they're frontline staff that are really operationalizing IPAC practices every day, right? So they're the ones that are really, really using it and following those IPAC practices throughout their shift many, many times. So some of the challenges that they have is time pressures, obviously to try to get all their work done, competing priorities. So they have a lot of different priorities that they're trying to juggle throughout their shift. And there's definitely like a normalization, I guess, of risk and PPE fatigue. So because they're using it so much through the day, sometimes you can have fatigue in using the PPE through the shift. So I guess a key insight is, compliance is not, it's not just knowledge. It's a combination of the environment, the culture, and the leadership together. So all three of those make a difference. So it's not just having that information, right? That's only going to get you so far. So another group is the physicians and the medical staff. So you know, they they have an eye influence on culture and practice. So and they often operate with greater autonomy than nurses, for example. But there are also some common issues. So there is like variable adherence to IPAC practices. So and certainly a resistance to standardization. So of the two groups, we're just talking about physicians will probably be their adherence to the IPAC practices will be lower than that of nurses, for example, just to compare the two groups. So you need to have engagement with physician champions to help with the IPAC programs, and you need to get work on the alignment of IPAC with and connect it with clinical outcomes and patient safety data. So that's how you need to. One of the ways you need to approach it with physicians is to align it with those clear clinical outcomes and patient safety data and how it impacts. So you got to show that impact when you're talking about the stakeholders of physicians and the medical group. So another key stakeholders was your leadership team. Can't forget about the leadership team. So that's the managers, the directors, administrators, the executives. executive directors. So, area are setting expectations. They're allocating resources, including resources for IPAC and quality. They're part of defining the culture. So a less things to take out. And, a critical point is if leadership doesn't prioritize IPAC, then frontline workers won't either. And they also need to model the leadership for IPAC. But they have a significant impact on infection prevention and control programs from a number of reasons, which I've met. They're often set those expectations, or they're modeling the behavior. They're the ones that are allocating resources for the IPAC team, and they're certainly part of helping define the culture as well. So very very important. That they're setting an example um, throughout the day. And I've already done an episode on leadership and what happens when they don't follow IPAC protocols throughout the day. So the other thing is when it comes to like designing new facilities, the leadership team uh, also impacting IPAC because they're making decisions around infrastructure and design, which is extremely important for designing a new building. So IPAC needs to be brought in right from the start for that. Another key internal stakeholder is your environmental services staff. So they all, and I mentioned in previous, at least one or two previous episodes, they are a group that often get missed or don't get enough credit for the impact that they have on infection prevention and control. So they have a huge impact, and it's really so often very understated how true of an impact they have on a day-to-day basis in the spread of infectious diseases in acute care, long-term care, any healthcare setting. Their role is extremely important in terms of day-to-day transmission of infectious diseases, as well as in outbreak management. So a very big player, very big stakeholder, internal stakeholder. So, and it's sometimes people think about it like, um, you know, cl- uh, housekeeping, with a different perspective, but, cleaning is not just this, it's not just housekeeping, right? There's the huge part about, uh, what they do day to day basis. That's, risk mitigation and reducing the risk. So they do have a big role to play. And there's a lot of standardization in their role. So they will have structured cleaning and disinfecting models. They'll have often will have digital tracking and auditing tools that they use within their team. So they're like a crucial internal stakeholder. So another internal stakeholders is facilities and engineering. So IPAC, you got to think about it's critical for facilities and engineering to make sure that that airflow is working the way it should be when you got negative and positive pressure. So OR, you want to have the positive pressure in OR. So you don't want anything from the outside and airflow going into the operating room. You want it going from the operating room, the airflow to the outside of that into the corridor. Whereas when you have um, an isolation room for example for TB, and a negative pressure room, then for isolation purposes, then you want the airflow to be going from that isolation room to the outside. And the same thing for during construction is you want, again, negative pressure because you don't want anything that's been disturbed due to the construction to be entering back into the facility. You want it to be going outside, so it'll be negative pressure. So, so facilities and engineering is a key stakeholder in making sure that the airflow system, negative and positive pressure within healthcare settings is working properly. Also, major player in reducing like Legionella risk. So and look at the water systems associated with the healthcare settings and make sure they're working properly and lowering that risk for Legionella. So, and I've already talked about, they're clearly a big player, a big stakeholder for construction risk mitigation. So, and I've done a full episode on it, or several episodes actually on construction. I was planning to do more. I just haven't gotten to it. But, early IPAC involvement in the design and construction, um, it's going to equals to like reducing risk. So risk prevention, is so important. So that's just gone through a few of the internal stakeholders. Um, and then you got a number of external stakeholders. So here there's many to list. I'm just going to go through some. So you got your public health authorities. So you're working closely with public health. They're a key player. You have reporting requirements. You got outbreak coordination. You got policy direction. It's a relationship that really you need to spend a lot of time building. Everybody has different perspectives. My perspective was always, and that's because I've worked for public health in the past for 12 years, so I've got that experience. But I do feel a lot of healthcare settings are very um, taken back or almost like intimidated when public health comes in. But like again, they've got a role to play to looking to see if everything is running properly, especially, for example, in an outbreak. And you need to think about it in a more positive way that it's another perspective or another set of eyes on the floor that it can help you identify possible problems that may be extending an outbreak. I think that relationship, when you have a good relationship with public health, it's a very important one. It will help you better manage outbreaks, in my opinion. You'll get better interaction, and it's a relationship you build. You may not always have the same public health person you're dealing with, but you're going to be dealing with them on a regular basis when an outbreak is declared, throughout an outbreak, and when an outbreak is declared. So you'll end up interacting with a number of healthcare public health professionals, and they should be part of your and invited to your infection control committees as well. So there should be someone there. All you can do is invite them, or invite public health. They may not get to attend every time because there's so many meetings that they have to attend. So other um, in addition to public health, you could, especially when you're in an outbreak or you're moving into a new facility, then you're going to have stakeholders like external stakeholders like the Ministry of Labor going to be involved. They can come in during an outbreak to make sure that you're doing everything you can to protect staff. And, also like the Ministry of Health, the Ministry of Long-Term Care, also external stakeholders that play a vital role in terms of being regulators for the programs that, acute care, long-term care, primary care. So there are other key external stakeholders coming in. And then another one I just don't want to forget is some provinces have what's called IPAC Hubs, so infection prevention control hubs, that support a number of settings. So it could be long-term care, acute care. So there could be primary care. So they provide a level of services and provide education to staff, training for staff. They will help with audits. Do help it with when you're in an outbreak. So I've utilized IPAC hubs a great deal when I worked for infection control in Ontario. And I think it's a service that sometimes doesn't get utilized enough, and it's an amazing service to tap into. So I highly recommend you if you're working in a province where you can tap into an IPAC hub that you do so. So they're another extremely important stakeholder, external stakeholder that could play a significant role in how you're running and managing and leading your infection prevention control program. So, um, and then another one, external vendors, you could be, it'd be like some of the industry partners. So, the vendors would be example one, the industry partners. So, they're group, they're the ones providing, may come in and provide, you're ordering your supplies from, your PPE supplies from, your disinfectants. So, they're very important and these are strategic partnerships, in terms of with education, innovation and running pilots. So, extremely important that you're connecting with vendors and then industry partners as well, and getting to know the different products and, you know, different conferences like the IPAC Canada conference that's going to be coming up in next one in May in Toronto towards the end of May, IPAC Canada. So that talk to a conference that will have a lot of vendors set up at the conference, and certainly would encourage people to talk to the vendors and because they got a lot of education, a lot of material that they can distribute at the conference, and it gives you a chance to kind of see those products and see some of the research that's been done. So again, they're a very important partner as an external stakeholder that you should be interacting with. Others would be anybody coming in provide external partners coming in to provide services. So could be someone who's providing air salon services, foot care would be another one, and dental services. So again, these are you need to be there'll be policies more than likely for any organization that's offering those services. So for foot care and dental, I'll start with foot. We'll go with those. That still as it you're going to be inspecting the equipment that's coming in because they're coming in external. And you got to make sure that there's proper sterilization of the equipment that they're using, and making sure that they're bringing in enough equipment for all the residents or patients that they're going to be seeing. So you're going to be inspecting that equipment, inspecting the temperature logs when when they come on site, and it should be done on a regular basis, at least I would say quarterly. So then again, there are a lot of external uh, stakeholders. Let's consider. So another one is such a big one is patients and residents and families. So they're sometimes often overlooked as a stakeholder, but they're a huge, significant stakeholder in healthcare, right? So and they have an impact on compliance, so with masking and hygiene. They impact transparency and trust. So communication with the families and residents is very important on a day-to-day basis. And we can think about it like a regular outbreak. Be a great example where you got to make sure that you keep in regular contact and keep communications with families um, and residents and patients that they're aware of an outbreak. You keeping them well informed so through communication. So important. And I've already talked about regulators, so like the Ministry of Health, Ministry of Long-Term Care, and the Ministry of Labor. Different provinces might have different titles, but uh, those regulators and as well as accrediting bodies like Accreditation Canada, another key external stakeholder. So as you can see, we going through a few, and I probably may have missed some, but I think I tapped into a good number of the stakeholders. Um, so I think but in case I missed a couple, but I think you get the point that there's a lot of external stakeholders and internal stakeholders that make a difference in terms of running daily an infection prevention and control program. So Next segment, I just want to tell so where does the stakeholder engagement break down? So sometimes what happens if you got silos between your departments and departments are not communicating well together, or your leadership team is not communicating well together, then you can have a breakdown in the communication, right? And that breakdown of communication is going to affect your infection prevention and control program. So, and then the other one would be another where we can break down the engagement is stakeholder engagement is internally, or is the lack of shared accountability, right? So it could be a couple departments, not taking full accountability for how they've impacted the infection prevention and control program. Sometimes the breakdown on stakeholder engagement can occur because of IPAC being seen as policing instead of partnering with various departments. So uh, you want to build your IPAC program so that you're seen as a key partner and working with all the departments. You don't want to be seen as someone who's just focused so much on compliance, and because it can come off as a type of the form of policing on the floor. 'Cause you want to, and that's not what you want. You want to be building the IPAC culture. You want to be building those partnerships. So they're so key important to the success of an IPAC success of a comprehensive IPAC program. So, and I think that I may have already connect now, but poor communication during outbreaks. That's for where stakeholder engagement is going to break down is if you got poor communication during the outbreak. So you got to make sure that you're having your outbreak meetings and you're providing lead updates to your leadership team. So you got to make sure you got good communication. They're using email, that you're doing huddles with the staff on the floor, and that your presence on the floor a lot during the outbreak. Sometimes it can be challenged because there's a lot of paperwork that needs to be done, a lot of documents that need to be filled out, reports submitted. So, but you do need to try to get onto the floor as much as you can to see how things are going with the outbreak. So, some of the examples um, where it could be as a sign of a clear breakdown in the stakeholder engagement is if, a construction project starts without any IPAC involvement, which shouldn't occur, but it does occur. So you need to be working on that, because that's an example of a stakeholder engagement breakdown. Environmental services department, not being included in outbreak planning. So they need to be that's your part of your outbreak management team. And they need to be there when provide updates to the leadership team as well. Another breakdown in stakeholder engagement would be, physicians that are not in line with isolation protocols, or so they're not following the protocols that have been put in place to protect that particular resident. So it's very important that they follow those protocols. And so you need to be working with the physicians and the medical director to make sure that there's no breakdown in that key internal stakeholder with the medical team. So, in leadership, some strategies. Leadership is so important for an IPAC program. So leadership strategies for success. You want to shift from that compliance to building the IPAC culture. So if you focus just on compliance, your program is really not going to evolve. It's going to be seen as more as policing and not part of a partner. In order to build a culture, you need to build it from the frontline staff up. It needs to be supported by the leadership team. But if you really want a strong, solid infection prevention control program, you need to build it from the ground up, from the frontline staff. And then you have a program, infection prevention program, that's working 24/7 because all the IPAC measures become part of their day-to-day practice, part of the built-in culture. And even when you're not there, they're practicing good IPAC protocols and IPAC measures. Because an IPAC team and anybody that's helping audits cannot be there all the time, so it's still supportive of that it being used. But it can only be part of your IPAC program. You really need to focus on a longer term perspective of actually building that IPAC culture, and it really does start with frontline style. So it's important that some of the practical strategies. You need to embed IPAC into governance structures. Um, So you need to do that. Another one is you need to have regular interdisciplinary rounds where various professionals are getting together just for a few minutes. So you need to be part of that. You need to use the data to tell a story. It's how things are going and the difference that it's making. So you need to make it that personal connection that following the IPAC protocols is reducing the duration of an outbreak. Fewer people are becoming symptomatic, or fewer deaths during an outbreak, all because of what the staff are doing day to day in terms of protecting residents and patients by applying the appropriate IPAC protocols and following the hygiene policy and following the PPE policy of donning and doffing, for example. So important there. You need to, it's good to acknowledge champions within your organization, whether they're internal champions, part of your internal staff, or whether they're external stakeholder champions. You need to, identify them and give them the appropriate credit, as well as the impact that they're having on your IPAC program. And you need to make sure that IPACs is within your organization as part of your organizational priority. So that's really important, right? Like that is built in for under patient safety, quality. That's very important. So you can make sure that uh, I, IPAC aligns with the organizational priorities, right? It has to be part of the priorities for the organization. For any healthcare organization, quality and infection prevention control is very important. So it's part of the healthcare system. So it's not just a department, and it should never be like in a silo. It is really a systems capability, right? It's a systems wide component of an healthcare setting is the infection prevention and control. So kind of wrap up this episode. Like I said, this episode is about 30 minutes. IPAC success is really, and I'm talking today about stakeholder alignment. And I went through a number of internal and external stakeholders today. And I may have missed a couple, but I think you'll get the idea of how many key players there are when it comes to stakeholders and for the working within an healthcare setting and all those partnerships that you need to work on and build in order to operate and have a comprehensive infection prevention and control program. So, those internal, external partnerships are essential. So I can't emphasize it enough how important they are. So if you really want to strengthen, an infection prevention program, you don't just look at you got to look beyond the policies, the guidelines, and those documents, and you got to really focus in on the relationship. So you need all the policies and you need all the guidelines and that are created, but by themselves, you won't have a strong infection prevention control program if you don't build those relationships and those partnerships with your internal and external stakeholders. They're extremely important. Um, so and they're very important when it comes to like well, day to day. So it doesn't matter, if you were going to reduce the infections and spreads on a day to day basis in any healthcare setting, they're going to be very important in outbreak management. So we can't. They're a vital component. Want to thank you for listening to this episode today. Today I focused on talking about the impact that those stakeholders, internal and external stakeholders, have for a infection prevention control program. Thank you very much for listening to this episode. Please subscribe and follow the episodes. I have on Spotify, uh, Amazon Music, Apple Podcasts, and YouTube as well. And I do all the announcements for the episode releases on LinkedIn, and I include all the link in the comments. So in the first comments that are usually made for the podcast episode will contain all the uh, links to access the podcast. So thank you very much for listening. And my name is Wayne Tucker. I'm the host for an Infection Prevention and Control Exchange uh, podcast, and appreciate very much for listening today. Thank you.